Good Friday afternoon to everyone. Wynn Brown here with Haywood Healthcare's COVID-19 update for Friday, March 12th. Unbelievably gorgeous day out there. So warm. I just walked outside so I could experience it after being inside all day so far. I hope everybody's taking advantage of that. And a little taste of spring. Cold weather's going to follow up, but it'll get warm again. We know how spring works in New England, so take advantage of that. Today is actually a milestone day for COVID-19 testing at Haywood Healthcare. It was 1 year ago today, March 12th, that we sent our first specimen out for testing. And here are some other milestone dates when it comes to looking at our testing. March 23rd, 2020, we had our first COVID-19 positive result. On April 13th, we had our highest day positive average of 21.6%. Our lowest day was June 23rd at 0.06%, and on October 21st, we had our highest number of samples, COVID-19 samples collected in one day. 747 tests were done that day. And on January 5th, not that long ago, we had our highest number of positive test results in one day, 54. And we have tested 65,845 tests so far. So just amazing work by our testing team in our lab, and a huge shout out and thank you to them. They have done incredible hard work to make sure that we can do our testing on schedule and take care of our community. Interestingly, I'm going to give you the census in just a minute, but our 7-day rolling average for positive tests in our community is down to 2.5%, so that is amazing, closing in on the state at 1.72%. However, we have 9 patients at Haywood today that are COVID positive. So that's coming down, but we do see a little bit of a trend upward on our inpatient census. And so just to let everybody know that is what we are dealing with right now. So again, even though we are vaccinating people, you still need to wear your mask. You still need to follow all the protocols, and just a continued call to action. This is not the time to rest. So we need to keep focused on that. There is the usual graph with the community data and our statewide data out there, so you can take a look at that. I do want to take a minute to talk about COVID vaccinations. You know that we are running our own regional testing center right now at the Polish American Citizens Club. And again, a huge shout out to the club for their support of us and our communities to do that, and all the volunteers that make it happen. But we also did have some issues with our vaccine delivery this week from the state, which gave us a bit of a hiccup on Tuesday. And so we did have to turn some people away at the end of the day that were scheduled, and they were very agreeable to be rescheduled for next week. And it arrived late on Wednesday, and we tested, where's my number? It was like 700 and something patients between 1 and 3:30 in the afternoon. It was pretty amazing how the team performed. So a shout out to everybody. And please, if we have a little hiccup, please know it's not us. We're doing our best to take care of everybody. And we have teachers that we need to take care of now, and our communities. And we're only getting the same amount of shipment. We have not been getting the delivery of the second doses, and now we have people due for second doses, and we're working very hard to get a larger distribution. So please know we're working our best. And so just make sure that you take a look at our website and the City of Gardner's website for regular updates. WGAW 1340 or 98.1 FM on Saturday 12 and 1. You can hear Mayor Mike Nicholson's Emergency Director Paul Topolsky's updates on our program. So we're trying to get the information out as quickly as we can. Appreciate your patience, and I know it's still challenging to get us a lot. They fill up very quickly, but we're doing as soon as we can get more vaccine in our hands, we will definitely expand how many people we're testing on a regular basis. We've had a lot of notes of gratitude coming in, one from us to the Colonial Hotel and their staff, who've been providing delicious meals to keep our clinic volunteers well nourished. They've taken care of a number of our lunches. Also, thanks to KROs, they have been sending snacks to the clinic that are timely, delicious, and greatly appreciated. And then we also had an anonymous donor who funded a delicious meal from Williams Restaurant. So thank you for that. We also had a meal sponsored by Mayor Mike Nicholson, State Senator John Cronin, and State Representative John Zlotnick. They all came to see the clinic this week in action. And State Senator John Cronin hadn't been there before and was very impressed with the flow and throughput that we have. Everybody tells us we run the best clinic in the state. I've got to believe it. And they provided a delicious lunch from Adicia Cafe on Tuesday, so thank you for that. I also have to give a shout out to the Gardner Police Department. You know, we have a lot of traffic running through that parking lot at the PACC, and they have just done a great job of managing that, and we could not do it without them, especially with some of the surges we've had in vaccines that we've been doing. So thank you to our police department. That's right. So on Wednesday, we did 700 vaccines in 3 hours. And we had a Hallmark day this week as well, where we did 1,000 residents. So we've been working really hard, and it's amazing. One quote was, "I can't believe all those cars, how well the clinic run, how well run the clinic was. No wait time, so efficient, tons of people, and no one was waiting. It couldn't possibly have been any better." So thank you very much for that. Those compliments to our staff and our volunteers. And remember, it's almost all volunteers that are running those clinics, and so we are rocking it there when we do it because we're Haywood strong. Just also, we are in the midst of our 2021 Community Health Needs Assessment. We do this every 3 years. Every hospital in the state does it. And you have an opportunity to participate in that as well. There's a QR code below or a link to our SurveyMonkey, and I encourage you, if you have an opportunity to weigh in and give your thoughts on our community health needs, that you do that and take advantage of that, and that will roll into our planning for the next 3 years. Also, internally for our staff across the health system, we are changing linen services coming up on next Friday, March 19th. And so we're very excited about this. I think we're going to have a higher level of quality and service, something we definitely need. So occasionally, if you wear scrubs, you know, sometimes they make it home. They make really nice jammies. We all know that. Our kids love them, but we really need, if you have some at home, please bring them home by March 19th so we can get those to the old linen service and don't get charged for them. So I encourage you to rummage around your house if perhaps something made it home so that we can get those back to the old linen service and get our new service underway. Also, just a reminder, and I know managers and directors have been talking about it around the health system today, but in the midst of the pandemic and a lot of things going on at home, that we have gotten a little loose on our cell phone utilization while we are working. If you're not a manager or director who are using that as part of your daily work, your cell phones need to be put away while you are working, unless you're on break or a lunch break, and not being used in front of patients. So just a reminder to be super professional and make sure that your phones are away. I know they're ubiquitous in today's world, but we're taking care of patients in our community, and please put those phones away and use them per our policy on breaks and not in patient care areas. So I thank you for that. And lastly, we have the latest update from Governor Baker here. There's a link for it, easy for you to get to. Again, I appreciate everything the community is doing to support us as we continue our journey to be one of the best community-owned health systems in America. Have a fantastic weekend. Thank you.